Welcome to another edition of What You Need to Know. My name is Asma Unuhu from Federal University Teaching Hospital, Lafia. Today, we will tell you what you need to know about your mental health. Dr. Paul Agbo is a consultant, psychiatrist, and HOD of Mental and Behavioral Department. He will enlighten you on this important topic.
I'm Dr. Paul Agbo, consultant psychiatrist with the Federal University Teaching Hospital. As a psychiatrist, we manage mental and behavioral health issues. When people hear about psychiatric issues, most times they just think that it has to do with people who are mad. But psychiatry has to do with, first, emotional problems, secondly, behavioral problems, and then thirdly, the psychiatric issues. So it's a combination of many of these things. People who have emotional and behavioral problems may not necessarily be mad. And so, for instance, people that cannot sleep, they are not mad, but they have psychiatric issues. People who worry a lot, they are not mad, but they have psychiatric issues. And more commonly now, we see that a lot of young people are into gambling and they take substances. These are psychiatric issues and they have nothing to do with madness. And so, if you see people with any of these conditions, please refer them to the psychiatric department. We also have some conditions in children that has nothing to do with madness. There is no shortcut for the names, so I'll have to call them the way they are. There's something called autism spectrum disorder, where a child who has been developing normally will reach the age of 3 years and then begin to regress and start behaving like a small child. There's something we call attention deficit hyperactivity disorder. Some people think it's just stubbornness and they end up beating their children and injuring them. But this is a psychiatric disorder for which there are management or treatment options. And then old people, we're beginning to live to old age now. We see very old people more commonly in our environment. Majority of them suffer from what we call dementia. Dementia is an illness that is characterized by memory loss and then some odd behaviors. These are the people that people who are not aware will say they are witches or wizards, because when you say something to them, they keep on saying yes, yes. These are the common things we see in old age, in addition to those who do not have dementia but have memory loss. In old age too, people lose loved ones and they react to it badly and they begin to behave in abnormal ways. You could also bring them to the hospital. The summary of everything I'll say is that psychiatric illnesses are illnesses that affect the brain, the same way hypertension affects the blood vessels and the heart, and diabetes affects sugar. Psychiatric illnesses affect the brain. There is nothing spiritual about psychiatric illnesses. When you take these people to pastors or imams, you are wasting time and the situation will get worse. If you see anybody behaving in a way that you do not expect them to behave, please bring them to the psychiatric department and we can assure you that they will be treated. Thank you.
Okay, sir. What are the first approach? What is the first approach one needs to know when coming to the psychiatric department?
Well, when you have a patient with this condition, it's usually treated as an emergency because they do not know what they are doing and so they can harm themselves and harm others. So if you come here straight, you come to the psychiatric department, we'll attend to you. You don't need to know anybody, you don't need to use any long leg, just come and we'll attend to you. But most importantly, is for relatives and caregivers to know that this is a condition, a medical condition that can be treated. Where we have issues is where people do not know and they waste time going round about wasting money. By the time they come, simple drugs they will tell you they cannot afford because they've wasted their resources. So what to know is, one, high index of suspicion. Like I mentioned before, when you see anybody doing something that you do not expect them to do, the first thing you should think about is a mental health condition and you bring the person here. The take home is this. We are seeing a lot of people suffering because they do not know that, one, psychiatric illnesses are not spiritual. 2, that psychiatric illnesses can be cured. And so you will do yourself and your loved ones a lot of good if you bring them to the hospital without waste of time. We have plenty patients we have attended to. Many of them have gotten well. All these conditions are called ISCA. As far as we are concerned, they are psychiatric illnesses, and if you bring your patients, they'll be cured.
Thank you, Dr. Paul Abo, for this enlightenment, and thank you, viewer, for being part of this edition. Once again, I am Asma Unuhu from Information and Public Relations Department, FUTH Lafia.